Welcome back to the Score Builders Question and Answer podcast. This podcast provides members of the Score Builders team with the opportunity to explore challenging multiple-choice examination questions with students actively preparing for the licensing examination. Ready? Let's go. A patient with type 2 diabetes reports lightheadedness upon standing from the plinth during a therapy session. Their resting heart rate is also noted to be abnormally high. Which rationale best explains these findings? Option 1. The patient's symptoms are due to poor circulation from peripheral artery disease. Option 2. The patient's symptoms are due to an inner ear dysfunction, a common complication of diabetes. Option 3. These are signs of autonomic neuropathy, which can impair cardiovascular responses. Option 4. These findings are a normal response to standing and are not clinically significant in diabetic patients. Patients with diabetes can develop complications that may affect how they respond to exercise. Physical therapists must carefully monitor for symptoms such as lightheadedness, abnormal heart rate, and blood pressure changes, as these can signal underlying issues that may affect the safety of a therapy session. Recognizing and responding to these signs early is a critical part of managing patients with diabetes. We have two distinct findings: lightheadedness upon standing and arresting tachycardia. The key word in the question is best, meaning we need one explanation that accounts for both findings simultaneously. Any option that only explains one of the two findings is incomplete. Keep that filter in mind as we work through each option. Let's explore each of the options. Option 1. The patient's symptoms are due to poor circulation from peripheral artery disease. Peripheral artery disease is a common complication of diabetes caused by reduced blood flow in the arteries. While PAD can cause symptoms like leg pain and fatigue during activity, it does not directly explain lightheadedness upon standing or resting tachycardia. This option fails the test. Option 2. The patient's symptoms are due to an inner ear dysfunction, a common complication of diabetes. While inner ear dysfunction can cause positional dizziness, it is not a recognized complication of diabetes. More importantly, inner ear dysfunction does not explain the resting tachycardia observed in this patient. The inner ear has no role in regulating heart rate. Again, one finding at best, not two. Eliminate it. Option 3. These are signs of autonomic neuropathy, which can impair cardiovascular responses. Autonomic neuropathy in diabetic patients damages the nerves responsible for regulating heart rate and blood pressure. This can result in orthostatic hypotension, a drop in blood pressure upon standing that causes lightheadedness, as well as resting tachycardia due to impaired parasympathetic regulation. The presence of both findings together in a diabetic patient is a strong indicator of autonomic involvement. Option 4. These findings are a normal response to standing and are not clinically significant in diabetic patients. Lightheadedness upon standing and resting tachycardia are not normal findings in any patient population, including those with diabetes. In fact, diabetic patients require closer monitoring for cardiovascular symptoms due to the increased risk of complications such as autonomic neuropathy. Dismissing these findings as clinically insignificant could delay the identification of a serious underlying condition and put the patient at risk. This option should be eliminated on clinical reasoning alone. As a physical therapist, your role includes recognizing when a patient's response to activity or positional change falls outside normal parameters. Dismissing these findings is not only incorrect, it is clinically dangerous. When we apply our two-finding filter across all four options, only option 3 provides a single, coherent explanation for both lightheadedness upon standing and resting tachycardia. That's what makes it the clear and correct answer. The correct answer is option 3. Let's explore the all-student data. 60% of students selected option 3. These are signs of autonomic neuropathy, which can impair cardiovascular responses. The correct response. 30% of students selected option 1. The patient's symptoms are due to poor circulation from peripheral artery disease. 5% of students selected option 2. The patient's symptoms are due to an inner ear dysfunction, a common complication of diabetes. 5% of students selected option 4. These findings are a normal response to standing and are not clinically significant in diabetic patients. This question is an other systems question, which represents approximately 18% of all exam items. This question is a foundations for evaluation, differential diagnosis, and prognosis question, which represents approximately 10% of all exam items. This question is a level 2 question, since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Thanks for joining us on the ScoreBuilders Q&A podcast. See you next week.